Hello, this is the Global News podcast from the BBC World Service with reports and analysis from across the world. The latest news 7 days a week. BBC World Service podcasts are supported by advertising. This is the Global News podcast from the BBC World Service. I'm Valerie Sanderson, and at 13 hours GMT on Tuesday the 31st of March, these are our main stories. Spain has suffered its highest daily coronavirus death toll to date. The Russian parliament approves sweeping emergency powers linked to the pandemic. There are warnings that the healthcare system in the Democratic Republic of Congo can't cope with the multiple threats of coronavirus, cholera, measles and Ebola. Also in this podcast, social media platforms take down multiple videos made by the Brazilian president, accusing him of spreading fake news.
In the past few days, the president has posted videos of himself walking through a crowd of market vendors. In one clip, he says people should be allowed to go to work.
And we go to Australia, where unusually a fifth of the confirmed cases of coronavirus in the country are in people aged under 30. Spain has recorded its worst daily figure yet for the number of fatalities from coronavirus. 849 people have died in the last 24 hours. It's the latest in a string of very high tallies as hospitals struggle to deal with the pandemic. I got more details from our correspondent in Madrid, Guy Hedgecoe.
The latest death toll from the last 24 hours has hit a new high, 849 deaths over the last day. That takes the total number to over 8,000 killed by the virus here in Spain. And that is a big concern for the authorities in particular, because there was a feeling, and they certainly seem to have the feeling, that they were getting to grips with the virus, that it was starting to come under control. We did see a drop in the number of deaths. I think the fact that it's a new record high is of concern. And also the number of infections. We've seen a spike in that number between yesterday and today, 9,000 more, so over 85,000 people are now infected across Spain. That's higher than China's total number of infections.
What does this mean for the lockdown in Spain?
Well, the lockdown has been in place for over 2 weeks already. Yesterday, it was further tightened with new measures which essentially restrict all non-essential workers to their homes as well. Previously, they had been allowed to move around to their workplace. Now they're not allowed to either. So there is almost a total lockdown across Spain. I think the government hopes that these latest tighter restrictions will help bring the spread of the virus further under control.
Spain and indeed Italy have been the worst hit of all the countries in Europe, certainly so far. Is there anything the rest of the world can look at to see what is not happening, what might be going wrong, or is it not as clear-cut as that?
Here, there's been a problem with a lack of medical equipment. That's been a criticism that's been made. But I think that is a problem that many countries have, a lack of masks, a lack of ventilators and so on. But I think there have been certain factors in Spain, for example, the high death rate. In Spain, the spread of the virus has been very focused on certain areas of the country. At the beginning of the crisis, it was here in Madrid, the Madrid region. Now, that has changed somewhat, but there are certain points in the country, Catalonia as well, the Basque Country, which are under tremendous strain. And because the virus is so concentrated in those areas, that puts the healthcare services under enormous pressure. And I think that contributes to a higher death rate. And the other issue, which has been a big problem here, has been the spread of the virus to elderly care homes. And a lot of elderly residents of care homes have been dying because of the virus. That's been a huge problem here.
Guy Hedgecoe in Madrid. The United Nations has warned that the lives of many children in the Democratic Republic of Congo will be destroyed unless the country's failing healthcare system receives urgent support. The DRC is trying to deal with endemic cholera, the world's worst measles epidemic, and an Ebola outbreak. At present, the number of COVID-19 cases is relatively low, but there are fears of a catastrophe if it takes off. Our Africa regional editor, Mary Harper, told me more.
If you look at the figures, the coronavirus for now, anyway, is the least threatening. There's been 81 confirmed cases and 8 deaths. But if you put this into the context of the DRC, this enormous, chaotic, disorganised country, it also has malaria, which last year at least infected 16.5 million people. You have the world's worst measles epidemic. You have endemic cholera, and then, of course, in the east of the country, which is affected by a great amount of violence and population displacement, you have efforts to contain an Ebola epidemic, an Ebola outbreak. So Congo has got 5 serious diseases that it's currently trying to combat.
And remind us why the Democratic Republic of Congo's healthcare system is so poor.
I think, and this is something that UNICEF itself said, it called on the government to please put more resources into the country's failed healthcare system. Congo is a country that's extremely rich in minerals and other resources, but somehow, due to decades and decades of corruption and mismanagement, the government has been unable to invest money in public services. Also, we have decades of conflict in the east of the country where dozens of militias operate. You also have conflict in other parts of the country. So it's a combination, I would say, of government neglect, government mismanagement, and also endemic conflict in the country.
Mary Harper. In India, millions of people are reported to have become stranded after fleeing major cities when the government enacted a lockdown in under 24 hours. The Supreme Court has said the subsequent panic and mass displacement of people is a crisis in itself. The Booker Prize-winning author and activist Arundhati Roy says the Indian government has forgotten about large swathes of the population.
We are seeing something like what happened during the 1947 partition between India and Pakistan, which is a partition along religious lines in a way, but here along class lines. So you're seeing these big metropolitan cities ejecting their working classes, some 470 million workers, of which 80% are in the informal sector. And it seemed as though they didn't exist in the government's imagination when they announced the lockdown. I spoke to some of them who were walking and they actually said, Modi, maybe he didn't know about us. And you get the feeling that perhaps they didn't. To announce something like this with no preparation and to call it a lockdown in order to enforce social distancing or physical distancing, actually, in India, it has the opposite effect. It's like social compression. The big roads are empty, but inside people are squashed into their homes or they're walking in their hundreds of thousands for hundreds of kilometers, and they are getting beaten by the police. They have no food, they have no water. Then half the way they are told, no, you can't walk now, you have to go back. It's unthinkable. They had plenty of time while they were so worried about getting Indians who were flying in from outside and dealing with all the upper class people, They were not thinking about this. They could have given them a few days. They could have organized transport. They could have organized, for people to stay where they were and if they had to be tough, they should have been tough on the landlords who were kicking people out. They should have been tough on the factory owners who refused to pay them even their last month's salary. It's zero preparation, zero understanding. That is what worries me the most, that the government doesn't understand the country that it rules.
Author of God of Small Things, Arundhati Roy. Health services in New York have been overwhelmed by the number of cases of people with COVID-19. More than 1,200 people have died there. The New York State Governor, Andrew Cuomo, has appealed for medical staff from anywhere else in the US to help. From Washington, here's Barbara Platasha.
Andrew Cuomo warned that what's happening in New York will eventually happen in the rest of the country. We are the canary in the coal mine, he said. He urged healthcare professionals elsewhere to pitch in and relieve the state's exhausted medical workers, saying they would return the favor where needed at a later time. New York is already getting reinforcements. A Navy hospital ship and a field hospital in Central Park are expected to start treating patients shortly. President Trump has extended social distancing guidelines until the end of April, saying this could save more than 1 million lives.
Challenging times are ahead for the next 30 days. We're sort of putting it all on the line. This 30 days, so important because we have to get back. But the more we commit ourselves now, the sooner we can win the fight. and return to our lives.
State governors have been raising the alarm about a shortage of medical equipment, but Mr. Trump indicated that would soon be ending. He claimed that so many American companies were now producing ventilators, the U.S. would soon have enough supplies to send to Europe.
So far, more than 3,000 people have died in the US from the coronavirus. But at the weekend, the authorities were warning that up to 200,000 people could die. Gary O'Donoghue is in Washington. So what are the latest projections?
Well, I think we're going to hear something from the White House today about the kind of modelling that they've been doing. They seem to have been building their own model up from the ground, really, with the data as it comes in, although it does seem to be based on a particular university model from Washington State. And their projections as of today have a death toll in the range of 84,000 or so by the middle of August, the beginning to the middle of August. Their projections do have the highest death toll coming around April the 15th as well, of course. Now, we'll see exactly what the White House has to say, but the scientists there have always stressed that these are they are not guesses, but in many ways there are so many parameters that it's hard to know whether you're at the top or the bottom of the range. Meanwhile, at the moment, New York is continuing to struggle with the huge, vast numbers of cases it's getting. More than a third of the deaths have been in New York alone, and there's continuing concern among governors that they're not getting the amount of testing they need to do, particularly in the Midwest, and they're not getting the protective equipment they need for their healthcare workers. So still a lot of pressure on this White House to explain how it's going to meet the demand right across this country of 330 million people.
Gary O'Donoghue. A quarter of the world's population is now living under some form of lockdown due to the coronavirus. This means that millions of people are staying home, often against their will, in what can be a pressurised situation. France's Interior Minister says reports of domestic violence across the country have jumped by more than 30% since France went into lockdown. So is domestic violence likely to reach epidemic levels as well? Dubravka Simonovic is the UN Special Rapporteur on Violence Against Women.
I have recently issued a press release and called all states to combat domestic violence in the context of COVID-19 lockdowns, because we know that during those isolations, home is not a safe place on many occasions for many women and children around the world. So the main message for governments is that they need to continue with different measures to protect women and children against domestic violence that are predominantly victims in such situations. So it is important to see how to encourage all governments to continue with police interventions, because on many occasions also shelters are shut down, courts are not working and so on. So it is very important to see how to prevent increase of domestic violence, how to provide services. So governments should think about helplines, that should use text messages in order to receive calls from women that are not able to use regular means of phone calls and so on, because they are in the same place as perpetrators of domestic violence. They need to see how to provide alternative safe places, how to increase possibilities for women to escape dangerous places that could even lead to femicides in some cases.
Dubravka Simonovic. In reaction to COVID-19, countries around the world are trying to limit the movement of their populations in order to slow the spread of the virus. Panama, a country which links Central and South America, has come up with its own unique restriction. Beth Timmons has more.
Panama, one of the hardest hit countries in Central America, has announced a novel way to stymie the spread of coronavirus. From Wednesday, they will separate citizens by gender. Men and women will only be able to leave their homes for 2 hours at a time on different days. Women will be allowed to go to the supermarket or pharmacy on Mondays, Wednesdays and Fridays, while men will be able to go on Tuesdays, Thursdays and Saturdays. On Sundays, no one will be allowed out. So far, Panama has confirmed 27 deaths in their 1,075 cases of coronavirus. Like many other countries around the world, it has closed its borders to foreigners and non-residents and has ordered non-essential shops to close. According to the Security Ministry, more than 2,000 people were detained last week for not abiding by the quarantine. And Panama is not alone in this gender-oriented policy. The Malaysian government decided to allow only what they term the head of the family to leave the house to shop, as part of measures to suppress the outbreak. But this has had unintended consequences. Some men are unexpectedly finding themselves newly responsible for the grocery shopping. Government allowing a man to shop unsupervised? Disaster, was a joker reaction of one woman on Twitter. One Facebook post of 3 men scrutinising pieces of paper in a supermarket aisle has been shared more than 30,000 times, with poster Muzaffar Rahman saying the shopping felt like a treasure hunt, with everyone checking their list several times. Which is the celery? They all look the same, asked another tweet, with almost 20,000 likes. But help is at hand for those new to grocery shopping. Chef Sherson Lian has posted this video with advice on choosing fresh fish, chicken and shrimps.
Hey guys, alright, so harap semua anda sihat di rumah masa MCO ni.
In the video, he gives pointers for finding fresh food in the markets and checking its quality.
Membeli groceries, this video is for you. One of the most easiest way is look at the ice. Pastikan they're clear, shiny, menyelah.
And one state government and a supermarket have shared infographics labelling groceries and parts of a chicken to help those newly acquainted with the grocery aisles. It seems that the new measures and restrictions are testing human ingenuity, but in our tech-connected world, help and advice can be quickly found.
Beth Timmins. Russia is introducing strict measures it says are aimed at containing the COVID-19 outbreak. The government now has the power to declare a state of emergency and implement new rules as it sees fit. The legislation also includes harsh penalties, says our Moscow correspondent Sarah Rainsford.
They called it the antivirus package, a series of new laws and amendments meant to help Russian officials tackle the coronavirus outbreak. Most stark is the threat of up to 7 years in prison if someone violates the quarantine rules and others die as a result. For spreading what's designated as fake news on the virus, there's up to 3 years behind bars. The government has also been given the authority to declare an emergency situation and implement new rules and restrictions as it sees fit. All this comes at high speed and to the surprise of many Russians after weeks of officials talking of the virus as a foreign problem and stressing that the situation here was under control. With the number of confirmed cases now rising more quickly each day, first Moscow, then dozens of regions have gone into lockdown. Residents are now only allowed out for essential work or to the nearest pharmacy or food shop. Officials plan to use phone tracking and surveillance cameras to implement the quarantine and hold any rule breakers to account. The latest legal changes were rushed through Parliament with no apparent debate, only the assurance of the Speaker that the measures, like the lockdowns, are to help and protect Russian citizens.
Sarah Rainsford reporting. Coming up in this podcast, do you know who Joe Exotic is? Brace yourself, you're about to find out.
It's not every day that a zookeeper went to prison for murder for hire.
There are more captive tigers in the U.S. than there are in the wild throughout the world.
You know, people are nuts, man. They're all crazy. I'm sure y'all got a story to tell.
As the world remains mired in the impact from the coronavirus on death rates, health systems and the movement of people, institutions are looking ahead to the long-term effect of the crisis. The World Bank is warning about the economic pain that COVID-19 will impose on the economies in East Asia, including China, Japan and South Korea. I spoke to our correspondent Karishma Vaswani, who's in Singapore.
Well, Valerie, unsurprisingly, it is a pretty grim outlook if you consider the fact that Asia was the first place to get hit, with China at the epicenter of it all. And so what the World Bank has said is that there will be unavoidable significant pain in all countries in the East Asia region. And their outlook is that the poor will get poorer. There will be more people added to that basket of poor, unfortunately, and even rich countries will struggle to keep businesses and households afloat. Now, in terms of data and the figures that they're forecasting, what they're saying is that if everything stays the same at where we are right now with the current lockdowns and people working from home, not buying things, not flying, then in China, you could see growth slow to 2.3% this year. That's from 6.1% last year. But if things get worse, Valerie, that growth in China will slow to 0.1%. And to put it into perspective, China would be the only part of East Asia that would see some growth in the worst case scenario. Everybody else would have negative growth.
And what are they saying about the impact on the poor in particular?
What they're saying is that because of the informal nature of so many millions of people who have daily wages in Asia, these are the worst affected group of people because they do not have a way of savings most of the time. They don't have anything to fall back on. So again, in the base case, as the World Bank likes to call it, 24 million fewer people will escape poverty this year because of the virus. In the worst case, 11 million more people would be added to the basket of the poor. The World Bank says that the informal economy workers in that sector are the most vulnerable and need the most help. But given the lack of global consolidation and leadership on this issue, it's unlikely they're going to get it.
Karishma Vaswani in Singapore. The spread of misinformation has been a big issue during the coronavirus pandemic, and social media platforms have now taken down multiple videos made by the Brazilian President Jair Bolsonaro, accusing him of spreading fake news. The newsroom's Peter Goffin reports.
While governments around the world urge their citizens to stay home, Jair Bolsonaro has been encouraging Brazilians to ignore the recommended precautions. In the past few days, the president has posted videos of himself walking through a crowd of market vendors. In one clip, he says people should be allowed to go to work. In another, he demands a return to normality and says existing quarantine measures put in place by local governments will cause serious problems for Brazil. Twitter has taken down 2 of these videos, saying they will delete any posts that encourage people not to observe social distancing. Facebook and Instagram have barred a 3rd video in which Mr. Bolsonaro claims falsely that the anti-malaria drug hydroxychloroquine has been effective in treating coronavirus everywhere it's been used. In fact, health officials have said it's unclear whether the drug has any benefits to coronavirus patients. And the U.S. Centers for Disease Control have said it can cause serious health problems and even be fatal. Last week, Donald Trump said he was pushing very hard for doctors to consider hydroxychloroquine. Since then, at least 1 American has died from ingesting the substance after hearing Mr. Trump's remarks. Like Mr. Trump, Mr. Bolsonaro has been accused of downplaying the coronavirus pandemic in an effort to preserve economic interests. The Brazilian president has dismissed the virus as being no worse than a little flu or the sniffles. And he's argued that local governors who enacted social isolation rules did so for their own political gain. People are going to die, he said last week. I'm sorry, but we can't stop a car factory because there are traffic accidents.
Peter Goffin. Next to Australia, where new lockdown measures have come into force, it's emerged that unusually 1/5 of the confirmed cases of coronavirus in the country are in people aged under 30. Our reporter Virginia Eastman, who's in Perth in Western Australia, told us first about the restrictions that are in place across the country.
Australia has decided that its residents may not be seen in gatherings of more than 2. You must stay at home unless you're going to work or education. You can only shop for essential supplies like groceries and then go home without delay. Going out for personal exercise in the neighbourhood on your own or with 1 other person is allowed. But restaurants were shut down last week, and other restrictions were posed on any kind of business. Haircuts were shut down. So that's where we are, and the death figures are still very alarming because any death is alarming, but overall the country is feeling that these measures are actually working, and especially in the West, where I am, there's only been an increase of 9 cases in West Australia overnight, and most of the others are, of course, from cruise ships, which carry their own reputation with spreading this disease.
What is happening with the death rate and the infection rate? Because it's interesting, isn't it? In Australia, a lot of the confirmed cases are people under 30.
Yes, they do seem to be hitting it. At the moment, the total figure is 4,557 cases across the country. Almost half of those are in New South Wales, and that's especially where a great number of that age group is. Then you've got Victoria, and then the other states follow after that. The backpackers have been badly hit by this. There's apparently 140,000 of them in Australia who've chosen to stay, in spite of the fact that, certainly in my area at least, they were warned to leave before a full lockdown was put in place as long ago as a week. And in Bondi, it's particularly become a problem, and there's been a pop-up clinic set up there. And there's also someone set up a petition to argue that the backpackers should be given more leniency. But they are, of course, a mobile population, and that's the big problem. What the Australian government is trying to do is to stop people from being mobile. Interestingly, there are also flotillas of elderly people heading to the outback in caravans in search of clean areas, and both groups of people are regarded by the Australian government as a problem because, of course, they're migrating the actual virus when they move.
Virginia Eastman. South Africa is on day 5 of a 21-day national lockdown designed to halt the spread of coronavirus. There are more than 1,000 confirmed cases of COVID-19 in the country, and it's feared that number will rise significantly in the coming weeks. All schools and non-essential businesses are closed. The only shops allowed to open are food stores and pharmacies. Sales of alcohol are prohibited. Even a walk in the park is banned. But it's not been smooth sailing so far, as our Southern Africa correspondent Andrew Harding reports from Johannesburg.
If we find you at the same spot, same time, we're arresting you.
South African police handing out warnings here in Johannesburg.
I will not walk on the road again. I will not walk on the road.
And a few beatings too, as the security forces try to enforce a nationwide lockdown with mixed success.
Go inside, man! Go inside!
The problem, well, one of the problems, is that locking down millions of poor people in crowded neighbourhoods for days on end is, in practical terms, more or less impossible.
It's rough. It's scaring. We don't know how we're going to survive.
Shebi Machabele's husband just lost his job as an electrician, and one of their neighbours in a township outside Johannesburg has tested positive for the virus.
So do you have enough money now to buy?
No! I don't even know how much do I have to buy enough food. For now, to be quite honest with you, I don't have any plan. I'm very stressed.
We acknowledge the material impact our financial situation has on you.
Then there's the wider economy. It was already in deep trouble here before the virus. Now, well, listen to the CEO of a giant clothing retailer choking up on a conference call to his suppliers.
We can only sympathise with you. Excuse me. We hope that we'll all emerge from this.
When a local radio station played that on air, the presenter seemed to channel the anguish of many small business owners here.
The consequences of this lockdown are serious. Sorry about that. It's really hard.
So what about the government?
South Africans have come together like never before to wage this struggle against this virus together. I speak about
President Cyril Ramaphosa has been impressive, authoritative. But he leads a state that has been hollowed out by years of corruption and cronyism. If South Africa is to weather this storm, the private sector will have to step up. To that end, Adrian Enthoven is helping to run a special solidarity fund.
There is very strong leadership by Ramaphosa, our president, and very strong alignment between business and government. And I think the way that we are going to address this crisis is by joining hands between the private sector and government, which is what is happening. I am hopeful that we will be able to overcome this crisis.
The virus could indeed unite a fractious nation in the face of adversity. But right now, no one here is taking that for granted.
Andrew Harding. In this time of coronavirus and lockdowns, it's helpful to have something to take our minds off the grimness of it all. And that thing may just be a new series called Tiger King. It's all about the eccentrics and cult personalities in the stranger-than-fiction world of big cat fanciers. It's the most viewed programme on the streaming platform Netflix, and it's gone viral on Twitter. Let's hear a bit from the trailer for Tiger King.
It's not every day that a zookeeper went to prison for murder for hire.
There are more captive tigers in the U.S. than there are in the wild throughout the world.
You know, people are nuts, man. They're all crazy. I'm sure y'all got a story to tell.
Our reporter, Charlotte Gallagher, is one of the show's biggest fans, and she explained to Lawrence Pollard why it's so popular.
I think a lot of it is to do with people recommending it on social media. Some of the main characters like Joe Exotic, they're just the most marvellous characters to look at, and they become memes, they become GIFs. People are texting you saying, are you watching this? It's on Instagram, Twitter. And let me explain Joe Exotic. I showed you a picture of him before we came on air. Yes. So for people who don't know, he's the main character in this programme, and he owns a roadside zoo in Oklahoma. And if you close your eyes, you imagine a man with a peroxide blonde mullet, incredibly tight jeans, a dazzling collection of sequin shirts, always got a gun by his side, sometimes has a cowboy hat. As well as owning this zoo, he's also a country music singer. He ran for president. He ran for governor. There is nothing that Joe Exotic has not tried to do. I mean, if you wrote this programme and you said it was a drama, it was a film, people would say this is not real. It's too fantastical to be true. It's absolute. It's Shakespearean, Lawrence. You've got these big cat owners all across America, these feuds between each other. They're all saying things about each other. He's bad. No, she's bad. She did this.
So it drops into this world, this weird world that we didn't know existed, of people who own their own tiger.
Yes, and it's actually unbelievably not even that unusual. So the programme estimates that in the US there are between 5,000 and 10,000 tigers owned by people personally, not in publicly owned zoos, but these could be in someone's backyard or their own private zoos. Obviously, welfare standards in some of them aren't great, and you do see this in the programme.
Oh, wow. Oh,
and then there's this feud between Joe Exotic and a woman called Carol Baskin, who only wears leopard print, tiger print and cheetah print, and she has an animal sanctuary in Florida. And she takes in animals, she rescues animals, essentially. And there's mysterious rumours about her husband that's gone missing. And it's just this feud that gets completely out of control. And just when you think you've got a handle on what's going on in the programme, they introduce another character. And you're thinking, what on earth is going on? They've all got the most incredible dress sense. There's not one of them that dresses like a normal person.
You showed me the picture of Joe Exotic with a very, very sparkly top. But I've got to say, his tiger is several times his size.
Yes.
He's a terrifying, mighty, majestic beast.
Joe Exotic doesn't just have one tiger, or didn't just have one tiger. He had more than 100 of them. He had gorillas, he had crocodiles, lions, tigers, bears. I mean, you just have to watch this, because if you're looking for something to take your mind off coronavirus, let me tell you, you can't go wrong with Joe Exotic.
And there's not just one episode, there's several episodes.
There's 7 episodes. So I watched 6 in one day, which might have been a bad idea, because by the end of it, my head was quite confused.
Tiger
by what was
indigestion.
happening.
I'm surprised you didn't grow some stripes.
Charlotte Gallagher, who should be a TV critic, we think. And that's it from us for now, but there'll be an updated version of the Global News podcast later. If you want to comment on this podcast or the topics covered in it, you can send us an email. The address is globalpodcast@bbc.co.uk. And if you enjoyed this one, keep listening right to the end for news about another podcast. I'm Valerie Sanderson. Until next time, bye-bye.
The Compass is the podcast from the BBC World Service that really gets under the skin of a story.
I can tell you what I believe is not the truth, and you know it's not the truth, and I'll get away with it. So I will tell a lie.
With series that take an in-depth look at how the world today really works.
Sometimes I think that we are moving into the right direction and change is happening. And then I realize that 9 to 10 women get killed every day in this country, so I don't feel we're moving forward at all.
And why things are the way they are.
I have been socialized to be a soldier, to be someone aggressive, and even to dominate, especially women or other people. So I have this kind of fear that what if I one day become a violent person?
the Compass podcast from the BBC World Service.
She shamed the politicians into taking an interest in it.
Search for The Compass wherever you get your podcasts.